Hey, it's Dr. Scott from Chiropractic Associates in Long Grove, Illinois. Happy New Year. Today I want to talk to you a little bit about cervicogenic headaches. There was an interesting article published fairly recently, November of 2022, regarding cervicogenic headaches. Some of you might ask, what are cervicogenic headaches? Well, as the name implies, cervicogenic headaches are headaches that arise in the neck, or in the cervical spine, upper back, and then radiate up, providing the patient headache-related type of symptoms. So cervicogenic headaches have a lot to do with what's going on in your neck. So they have a very strong degree of association between your posture or maybe previous injuries. Many people with cervicogenic headaches have pain between their shoulder blades that then radiates into the neck. Cervicogenic headaches tend to be on one side. They don't throb often, but they tend to also be chronic, so day in and day out. And you can kind of figure out that a lot of these cervicogenic headaches are because of posture. Maybe they're spending a lot of time sitting at the computer, or maybe they've had some previous health history, but bones, joints, and muscles of their neck are under a lot of stress and strain, and that creates cervicogenic headaches. So the interesting thing about this study is this. Very large study. 20 studies that they went back and looked at the results of those studies, 20 different studies, 1,500 patients, so a large group of patients. Of those studies, 8 trials were specific to spinal manipulation. So 8 trials were specific to chiropractic adjustments, if you will. And the results of that studies were that for spinal manipulation, there was statistically significant reduction in frequency, intensity, and duration, both in the short term for people who had cervicogenic headaches, but also in the long term. So the chiropractic adjustment and other endeavors that were provided by the chiropractic doctor had long-lasting effects on those cervicogenic headaches for the patients with which they were studied. We also found that instrument-assisted massage, techniques like Graston, kinesiotape also reduce the frequency, intensity, and duration of those same cervicogenic headaches. Why is that important? Well, the reason why that's important is because so many chiropractic doctors, including our office, use not only spinal manipulation, but exercise therapies, kinesiotape, instrument-assisted massage, posture modification to help people with neck and upper back pain and consequently cervicogenic headaches. So in short, the conclusions were spinal manipulations with and without exercise or other endeavors is safe and statistically significantly reduces the intensity, frequency, and duration of cervicogenic headaches, both in the short term and the long term. This is really important. If you have a friend or a family member who has headaches and they notice tension starting in their neck, starting in their upper back, that then results in a headache on a fairly frequent basis, they would probably benefit from chiropractic care, and that's safe and effective, not only benefit in the short term, but in the long term. So if you have got some headaches or know someone that does, we'd be happy to assist here at Chiropractic Associates in Long Grove, Illinois. My name is Dr. Scott, and I hope to see you really soon.